right? You let them go until you want to surf on one of them. Same thing with your thoughts and feelings. Like, wait, now that one, that's a big deal. That one I'm going to do something about. That one is important to me. So spin it to win it. Name it to tame it. I already talked about, which is being able to identify and accept what we're feeling. Sometimes that helps a ton all by itself. It helps just to be able to identify it, but it certainly helps in being able to realize what you want to do with it or about it, is to be able to name it. What is it? Is it embarrassment? Is it frustration? Is it fear? A lot of times fear, especially guys, get fear mixed up with anger, right? Someone cuts right in front of you and you go, like that. Oh, that you'll do that. Well, right before you got angry, you actually felt probably fear, like, whoa, and then, oh, like that, right? And we if we can be able to identify that what's our real feelings, then we can do something real with them. Then third and most important, well, I don't know if it's most important, but it's very important, is what I call feel it to heal it. And what that means is that most or a lot of people talk about feelings. They talk about how to avoid them, how to avoid them, how to not feel that, how to not feel things, how to change our feelings, how to diagnose our feelings, how to analyze our feelings, all kinds of things about our feelings, but feeling them, not feeling them. I suggest, and what I've been working on for 35 years, and a lot of other people were working with this, is what we call feel it to heal it, which means you allow yourself to feel the darn feelings. Just allow it just for a minute, and then you can go away. What if we allow our body to feel what it wants to feel, and then breathe and then let it go, our body will thank us. Thank you, thank you, thank you. Our body does not need to carry around our fear, anger, and sadness inside. We do that. And we do that because we have all these judgments about it, and we can't show what we're feeling, and it's not okay to cry, and it's not okay to be angry, and all these other things. But we are sad, and we are angry, and we are scared. So if we allow ourselves to be those things, to allow those things, we can actually get them out of our body, and our body will thank us for them. That's the solution about the emotions turning physical. If we stuff our feelings and cram them inside of us long enough, our body's going to start falling apart. It's going to start falling apart. And that's not a good thing. That's not a good thing. If we just allow ourselves to feel, even just for a few minutes, even for a few seconds, our body is like, oh, thank you so much. We don't have so much in our neck and in our back and in our shoulders, and people carry their pain in their body. We don't have to do that. We don't have to do that. We can let it go. So feel it to heal it. Okay, so if you're in the classroom, what I would suggest, this is probably the most powerful emotional intelligence exercise we can do in class, is called the feelings check-in. And basically what that, I was trying to look for one, I should have got it earlier. You ever seen the chart of people's faces? I can supply one if necessary, but they're a happy face, sad face, scared face, angry face, embarrassed face, fearful face, all these different faces. Which one? What are you feeling right now? If we just ask the kids, what are you feeling right now? They can identify, they can become aware, they can accept, they can validate, they can connect, they can integrate, meaning put it into themselves. They can see that other people are feeling what they're the same as they are feeling. That's a huge part of it. The connection part is, oh, I'm angry today. Well, so are 3 other people or 10 other people in the class. It's okay. It's okay that I feel angry. It's not okay to hurt anybody or break anything about it. That's an action. but it is okay to feel angry. It's okay to be sad. It's okay to be afraid. Those are real things, and they're okay if we can make it okay with people. And I'm not weird. I'm not the only one feeling this. I'm not the only one feeling this. Other people feel it too. That's wonderful feeling to not feel broken and weird and problem, like you're a problem. When I grew up, I thought that nobody talked to me about my feelings. Nobody talked to me about them at all. And so I thought I was the only one having all these emotions. And that's not a good thing. I felt very alone and very, very sad about that. I wish people would have talked to me about it. And so I'm talking about it. I'm talking about it. I want people to see that other people have emotions too. Everybody does. Everybody. I don't care how weird you are. You still have emotions, and even animals have emotions. And that's a wonderful thought, to know that you're not alone. Not alone is a wonderful thing. The other thing is, as you guys probably may know, in the United States, we just in the last week we have had 3 big mass shootings. They're just, talk about sad and ridiculous, because they are directly related to these people being not knowing how to deal with their emotions. They were angry. The one kid shot 18 people, little kids. He shot 18 little kids because he was angry. Is that how you deal with your anger? No, it's not. But nobody taught him how to deal with his anger. And so that's what he decided to do with it. And that is just so wrong. It's so wrong that we don't teach this in all schools. We do need to know. Don't get me started on this. We do need to know about our intellect, but we every bit as much need to know about our emotions. If those people would have known how to deal with their anger better, they probably wouldn't be going around shooting people. And the other part of that is, in the United States especially, is that people shoot themselves because they have because they're angry or they're hurt or they're sad or whatever it is. They shoot themselves. And so if the kids in school, it's very simple little exercise, can see that I can deal with my emotions and I'm not weird. Other people have the same thing as I do. That's a good thing. That is a good thing. And it's probably going to save a lot of lives. Sorry, I'm going to get all fired up. So 3 of the most important emotional intelligence skills are resilience, perseverance, and grit, right? Grit is one of my favorite skills. It is super important. There's a lot of studies now on grit. It's a very real word. It's a real thing. Grit is like when you're gritting your teeth and you go, man, this is going to hurt, or man, this is going to be difficult, and you do it anyway. That's called grit. You know it's going to hurt, and you know it's going to take courage, and it's going to take strength on your part, and you do it anyway. And you go there, you have tough conversations, and you talk to people about things that are not easy to talk about. And you push yourself sometimes when you need to succeed, or if you need to help somebody, you can push yourself a little bit and be uncomfortable, and you can have some grit and resilience when things are not going well. You can do that. We can push ourselves through and not have to go away, and not have to run away, and not have to hide, and not have to shoot anybody, and not have to shoot ourselves. We can get through all this. And with the way things are going in the world, that's going to be needed more and more as things are not going very well. So resilience, perseverance, and grit. Try increasing all 3 of those. You'll be awesome. So in teaching, what we try to do is engage the kids, meaning get them involved, get them, ask them what they're feeling, get people so they're interested in it by engaging them. Then you activate it, meaning you train them, teach them how to do it different, and then reflect. So what did you learn? What happened? How did that go? What we're doing, I'll kind of go off on the side here for a second, is that what we're doing in our nonprofit is we're creating clubs in schools, clubs, CLUBS, and clubs. It's difficult to get emotional intelligence training into schools. They already are full of, they already have curriculum all day long. The teachers are stressed because they have so much that they're trying to get across to the kids. They run out of time. They don't know how to do this, how to teach emotions very well yet. And so it's difficult to get emotional intelligence as a class in a school. But we are doing clubs because they are either before or during or after school. And so they're adding to the school day, but they're also voluntary. They're also, you can go or you cannot go. And the way, so that changes things. If the kids are there by choice because they want to be there, they're a lot more likely to be engaged and to connect and to learn than if they're forced to go or they have to, or they're going to get in trouble if they don't. They're there because they want to be there. So that's a really important part. Another part is that we can make them fun. We make them fun and activities and enjoyable. And the way it works is we say, okay, we're going to do an exercise. We're going to do an activity like play a game, right? Any game. We could play soccer. We could play cards. We could play, it doesn't matter what we do. We can make it enjoyable. But we're going to have this game. We're going to play this game. And the point is to watch what you're thinking and feeling during the game. During the game, as you connect with other people, watch yourself and watch them. So we talk about that. We give a little introduction. We then play most of the time. And then at the end, we do this last part, which is reflect. So how did that go? What does this have to do with emotions? What does this have to do with you getting along? Did you feel like you fit in? Did you notice some other kids didn't feel like they fit in? What could you do about that? That kind of thing. You reflect on what you just did and let the kids, you bring it out of the kids. You don't force it into them. We can teach emotions a little bit. We can basically tell how they work, but feeling them and understanding them, their own self, how it was for them, that's what seems to be the most effective thing we can do for kids, is to bring it out. Emotions they never stop. They're they're kind of mushy, they're hard to identify, that kind of thing. So experience and allowing them is one of the most important things for kids. So engage, activate, reflect. Okay. I hope that was helpful. I'm going to give you just a couple of takeaways for this. First off is, like I said, emotional responsibility, most important. If you accept that and take ownership of your thoughts and your feelings, then you are in charge of your life. If you don't, you're not in charge, and that's not a good thing. That's not a good thing. It's not fun, and it's not effective. It's not a good thing. So teach kids that their thoughts and their feelings are theirs, and they can do things with them. Nobody made them feel that way. So, okay. So accept emotional responsibility first, and only if you want anything out of this. Commit to learning about your thoughts and feelings. Learn more about yourself. Become more self-aware, and model that, and model it, and find your peace and help create it inside of you and around you. And people will love you for it, and they'll be able to do it going forward and make it happen in their lives. So commit to learning more about emotional intelligence. And lastly, share it. Please share it. Most kids and most people don't have any idea about this. They don't know that they have thoughts and they have feelings. They don't know that their thoughts create their feelings. They don't know they can adjust their thoughts to adjust their feelings, to make things different, and that they're in charge to do that. Most people don't know those simple truths. And, correct me if I'm wrong. Maybe you guys all know this and you were learned this in school when you were little. I don't know. I didn't. And most people I know don't know anything about emotional intelligence. I like to ask people all the time when I meet people. I ask them, have you ever heard of emotional intelligence? And about half of them go, yeah. And I'd say, oh yeah, what's that about? And we start talking about it, and they go, so how's that going for you? And it's a little assessment kind of thing. but the other half of the people are like, no, I've never heard those words before. Emotional intelligence. I go, yeah, it's just about being smart with your heart, or being smart with your thoughts and your feelings, your inside world, being smart with your emotions. You can actually be smart with your fear and your anger and your sadness and your guilt and all that stuff. And they're like, really? You're kidding me. I've had a couple people, I think that was a life changer for them, literally, because they were like, oh, that's great. What a cool idea. I didn't know. I never thought of that before. Yes, you can be smart about your heart. With your heart, you can do it. And it's like, wow, that's super cool. So I please share what you know with other people, and help them realize that they are in charge of them, same as you're in charge of you. And we're trying to create peace inside us and around us, and eventually big peace in the world. So EQ for Peace Worldwide is our nonprofit. If you'd like to stay connected, we have tons of information, and we're getting so much more. Join our newsletter or our membership here. No cost to it. eqforpeace.org/connect, and sign up for that, and we'll stay in touch. So, all right. Are there any? I'm done with my PowerPoint. I'm going to stop the share. I am going to give this PowerPoint to Dr. Khalid afterward, and so he can give it to you, make it available to you on Google Drive. So you're welcome to it. Yes, I said on that last one, with great power comes great responsibility. What movie is it from? And Anita answered and said Spider-Man, and that is correct. That is correct, Anita. So you're right. I like to watch movies. I learned so much from watching movies and TV, and watching how to do it and how not to do it. Watching like, oh, that was great, or oh, that was awful. Oh, that was so bad. And I take pictures and take little videos and try to learn about that. But anyway, I find this fascinating subject. I hope it's interesting to you. People need to know about their thoughts and feelings. They're important. So important. So any questions or comments or disagreements? You're welcome to put it in the chat. A whole bunch of people have already raised their hands. They've been up this whole time. So I don't know if anybody has a current question or not. There's 20 people have their hands raised. I'm not sure why, but we can, I can take some questions if you like, or we need to go on. All right. So Anita said, such a brilliant session. Thank you, sir. You're welcome. You're welcome. Thank you for the thank yous. Session was beneficial, helping us understand, be more mindful about our emotions. Yay. So nice to know regarding the introduction of clubs. Yeah, if you're interested, let me know. We've got a whole bunch of information on clubs. We're doing a video on it tomorrow morning, and we're trying to make them show you exactly how to do them, how to get started, how to connect with the parents and the school. What do you need? You don't need much. And be able to implement clubs in schools for almost no cost at all. It's really great, and it's taken off like crazy. Let's see, what else did she say? Just a second. Chat's moving up. So nice to know regarding the introduction of clubs in schools to train children better about their EQ. Yes. Would we need a certified trainer or certificate to introduce the same at schools? You don't need one. It's helpful. It's helpful to be certified and to understand all this stuff pretty well. There's a lot to it. There is a lot to it. As it turns out, it's actually can be complicated, but it's not real. It's not expensive to learn. There's so many books and videos and trainings out there now. I'm very happy about that, and we're making more. So we can help you. We can help you get started. So you can, don't put it off. If you need to get certified, that's great. But do the club while you're getting certified, because this is urgent, you guys. This is urgent. People are dying to know about this stuff. So let's go. Figure out how to do it. I got thanks. You're welcome. Good session, nice session. Thank you. Very important for schools and students. Yahoo, right on. It should be an adult education, absolutely, all the way up. Like I said, preschool to PhD. Everybody needs to know about this, and hardly anybody does. consolidate your feelings and you wonder, what are your views? Yeah. Okay. I'm not. Okay. Thank you for a wonderful session. Thank you. Thank you. Thank you. Session was beneficial to help us understand and be more mindful. So nice. Okay. Same thing. All right. All right. Any other specific questions? I'm glad you guys liked it. I hope it was helpful for you. Please pay attention to your thoughts and feelings. Learn more about them and learn about other people's, how they work, and you will have so much better relationships. Listen to people. I had this thing called Shut Up and Listen. Actually it's SOUL. Shut up or stop. Open up and listen. Open meaning one of my favorite EQ skills is that we get to decide how open we make our heart, how much we want to open up to people or not, or close up to people. And we can do it all day. You can adjust. And if you're safe with somebody or you love somebody, you can open right up and have intimacy and wonderfully satisfying relationships. If they're not safe and it's ugly and they're grumpy or whatever, you can close up and protect your heart and have things bounce off and go, wait, that's them. That's not me. You're having a problem. You're having a bad day. Sorry about that. It's not me. It's not me. So I'm good in here. So anyway, you get the idea. Being able to open your heart and close your heart is a huge deal.
Okay. Okay.
All right. Dr. Khalid.
Yeah.
Talk to me. How are we doing?
Yeah. Thank you very much for your valuable thoughts and idea which you shared with all of us. It's really impressive and very important. The emotional intelligence is everywhere, at home and school, as well as to develop our child as well as ourselves. So really, we will be benefited from this, from your lectures, from your thoughts, from your valuable
Khalid, you're muted.
স্যার একটু আনমিউট হয়ে যান স্যার।
Khalid sir. Oh, I'm very sorry. Unfortunately, it was automatically unmuted, muted. So anyway, thanks, Mr. Mac Philistine, for your valuable thoughts and ideas shared with us. All of us will be benefited in due course and at home, and teachers as well at home and classroom, which you shared. Thank you very, very much from all of us to Mr.
Thank you for
Mac
having me.
Philistine.
Very good. Thank you.
Thank you. Bye-bye. So we'll request.
All right. I'll see you tomorrow. We're like I said, 2 more folks on our team are going to be doing the first workshop tomorrow and the next day. One of them was a teacher for 30 years, and then he became a school principal, and they taught emotional intelligence in their schools. He did it for real for a long time, and he's going to be speaking with me tomorrow, I think, or on the next day, and then another. So it's managing behaviors in the classroom. And the other one is managing behaviors at home. She is another Dr. Skelton is a parenting and family coach, emotional coach. And so we're going to be talking about managing behaviors at home. So I will see you tomorrow.
You introduce them whenever before the prior their speech, their lectures, you just introduce them, no matter, you will be with them as well. Thank you, Mr. Mac. So we request to Krishnan San, Professor Krishnan, Dr. Krishnan Sani. I think he's available now. Hello?
Sir, available, sir?
Yes.
Hello, Mr. Hello, Professor Krishnan.
Sir, namaskar, sir.
So I know you are assigned lot of assignment from the university, I know. So you couldn't make us during the conference as you have written to us.
Sir.
Yes.
My voice is clear, sir.
Pardon?
My voice is clear, sir.
Very much clear,
Yes,
but
yes,
a bit loud would be
Fine,
better
fine,
for us.
fine, fine. First of all, I must be thankful to you, sir, not as a organizing, member, but as a mentor and teacher. I used to consider you as a teacher, and surely I am thankful to organizing team, and Dr. Tapas is very much, active, and is doing so many activities. So thank you very much for this session. So now I'll just share my screen. Now I hope my screen is visible.
Yes, yes, go ahead.
Fine. So basically, we are discussing child mental health issues, assessment and management. I know it become overwhelmed by last session also, and there was very interesting session by Professor Matt only regarding emotional intelligence. I was there in between. So be comfortable. And my main hunch is we want to make it more interactive, rather than a didactic lecture. And be comfortable. Whatever language suits to you, English, Hindi, we will follow. Right. So be comfortable. Whatever questions comes in your mind, we want to make it more practical. Right. So in between, we try to make it bilingual so that everybody can understand this basic issues. As we know, this is a very important issue as we are talking about child mental health issue. So what we will going to be covering in today's session, basically behavioral and psychiatric issue in the child. Because अगर मैं बात करूं CRE के टॉपिक की, so that is very much familiar with this child mental health, barriers, issues with child population. Then we are talking about psychological assessment. If we make a diagnosis or if we want to go for management, there must be some psychological assessment in this particular group, which is very vulnerable group, I mean say. Then we are talking about disability. That is very important phenomena. That is very important aspect when we are talking about child population. Then obviously we are discussing psychological management. So यहाँ पे हम सारे issues को discuss करेंगे. We'll start from issues, then we'll start up to management. So one by one we will discuss as we all know. अगर हम child mental health issues की बात करते हैं, child mental health की बात करते हैं, तो there is three basic issues. One is behavioral disorder, the second is emotional disorder, third is developmental disorder. Right? So these three categories are very, very important. In all the psychiatric issues, psychological or psychiatric domain in child population, we basically consider the major pillar. So behavioral disorder has some own mental illness, emotional disorder has their own domain, and developmental disorder has their own domain. And all the population, you are expert in this field because being a special educator, being a mental health professional, clinical psychologist, you are dealing with all the gamut of the psychological problem. So we are discussing one by one here. For example, if we are talking about behavioral disorder, so behavioral disorder में बहुत सारा illness होता है, बहुत सारा gamut है. The major, or we can say the maximum population which comes in this particular area would be attention deficit hyperactivity disorder. आप डे टू डे लाइफ में देखते हैं, अपने क्लासरूम में, आप घर के आसपास देखते हैं, आप नेबर्स में देखते हैं, कुछ कुछ बच्चे एक जगह टिक के नहीं बैठते. They used to become hyperactive. This is a part of behavioral disorder. And if this severity will be more, अगर ADHD बढ़ जाता है किसी भी एज ग्रुप को, अगर मैं बात करूं, that can be converted into conduct disorder. And if this conduct disorder will be beyond that age group, this will become ODD, oppositional defiant disorder, and it can convert it to antisocial personality disorder. So that's why we are discussing ADHD, the part of behavioral disorder. So ADHD अगर हम discuss करते हैं तो इसके दो major symptoms होते हैं. One is inattention type, one is hyperactivity type. Right? These are the two different domains, but most of the cases or most of the children has this both domain, inattentiveness or hyperactivity, and can be some cases it has been seen as impulsivity also. As if we talk about WHO's this one guideline, the most common behavioral disorder in children is ADHD. That's why we are here to discuss childhood issues, childhood mental health issues or problems. There are various symptoms are there in ADHD. How to recognize, like for example, if you are in a school or if you are in a class, there are few children who are suffering with ADHD or who has these symptoms of behavioral problem. So how can you recognize that basic symptom? The children would be easily distracted. एक काम उसका ध्यान नहीं लगता, इधर उधर ध्यान हमेशा भटकता रहेगा, attention properly maintain नहीं कर पाता. For example, if you are saying some work to him, for few minutes he will concentrate on that particular domain, but the next moment he will shift. Right. So this shifting would be a basic domain in this one. Then he never listened properly. Then the instruction, whatever schools or work is being given to him, he won't follow that instruction. बहुत जल्दी उसके interest खत्म हो जाते हैं चीजों में. So these are the few issues which is a part of attention deficit hyperactivity disorder. When we are talking about inattentive type, हमारे क्लिनिक में अगर मैं बात करूं कि we are discussing in OPD basis, so many patients are seen, but maximum if we see gender wise difference, अगर हम लड़कों की बात करें, boys की बात करें, लड़कियों की बात करें, दोनों में भी symptom vary करता है. For example, the child who belongs to gender group of boys, he is more hyperactive. बट अगर हम बात करें गर्ल्स की, जिसमें बहुत कम केसेस होते हैं ADHD के, you know the literature of ADHD, the girls is more predominant by attention deficit type. Then we are talking about hyperactivity or impulsivity as we are discussing. For example, एक जन क्लास में बच्चा टिक के नहीं बैठता, इधर-उधर उछल-कूद करता है, बहुत ज्यादा बोलता है, you know, difficulty in playing with the peer group. Or these are the few issues which is basically interrupting others also. So this is hyperactivity. So these are the two major pillars as we discussed. One is attention deficit and the second one is hyperactivity. I hope slides are moving. Hello. Hello. If anybody can give me feedback, the slides are moving. Okay, just a minute. Just a minute.
sir, moving, sir.
You know, few people are saying this is not moving.
Yeah, sir.
Somebody is saying this is not moving in chat box. Can you check it, please?
And now, sir, slide not moving, sir.
That's why I'm saying. Just a minute. Just a minute. And just reach.
ठीक है सर
अभी okay?
हाँ okay sir.
Okay. Just a minute. Sir. Give me a moment, sir. So we were in hyperactivity or AD. Now is moving, is comfortable?
Yes, sir.
Fine. So next moment when we are talking about ADHD, the next moment would be conduct disorder. The conduct disorder, as I said, this is a severity of ADHD. When we are talking about ADHD, like why we are discussing ADHD, this question comes in your mind. So once this ADHD we won't target or we won't manage this ADHD, this will go into conduct disorder. And conduct disorder can be converted into ODD or antisocial personality disorder. Have you heard about this Nirbhaya Kant? This was a very famous Kant in Delhi. So basically, these persons were suffering with some triangular personality, for example, personality disorder. Sometimes it has been seen that ADHD children can be converted into in adulthood or as psychopath, sociopath, or personality disorder. That is the major reason we are discussing behavioral issues in children. और अगर हम टाइम पे उसको कंसंट्रेट कर रहे हैं, अगर हम टाइम पे उसको मैनेज कर रहे हैं, टाइम पे अगर हम उसको इंटरवेंशन कर रहे हैं, आई थिंक दैट विल बी वेरी गुड टू गिव अ हेल्दी चाइल्ड टू द सोसाइटी. Then the other issues, for example, if we are discussing the major role of conduct irrespective of ADHD, आपने बहुत सारे बच्चे देखे होंगे, they used to feel very aggressive, right? They used to destruct the properties, they used to destruct the animal, they used to damage the properties. You know, these are the few traits which basically part of conduct disorder, right? And it has been seen, as I discussed, more than 50% highly antisocial children are antisocial adult. So इसका मतलब क्या है? We have to target that particular issue when this trait has been developed, when the personality is a very molded phase. हम बोलते हैं ना ऐसा कि हमको अपनी जो पर्सनैलिटी होती है, बच्चे की पर्सनैलिटी, उसमें बहुत जल्दी हमको इंटरफेयर करना चाहिए, बिकॉज एक बार अगर पर्सनैलिटी कंसोलिडेट हुआ, then we can't change that personality. So that is the only reason we are giving more importance to prevention part. है ना, एक बार इलनेस हो गया, हम उसमें ट्रीटमेंट दे सकते हैं, we can interfere with the pharmacological treatment, non-pharmacological treatment, but the major issue we have to see that aspect if we can prevent that child. So ये मकसद है इस CRE का, so that we can recognize that symptom and we can intervene that particular symptoms. रीजन क्या क्या होता है? अगर हम बिहेवियरल इश्यूज की बात करते हैं, अगर हम बात करें कि बिहेवियरल प्रॉब्लम इन चिल्ड्रन, सो देयर आर वेरियस रीजन. We'll categorize into 3 basic parts. For example, one is parental and family risk. Like for example, if we are saying, do you think family is important for childhood development? Yes. दैट इज नोन एज चाइल्ड रेयरिंग प्रैक्टिस। इसलिए हम बोलते हैं ना कि बच्चे की परवरिश का जो फ्रॉइड का भी अगर हम बात करें साइकोएनालिसिस की, ही सेड अबाउट फिक्सेशन, if there is a fixation in any early childhood, there is a problem in adult life. For example, in oral fixation, anal fixation, or genital fixation, or phallic fixation. But at the same time, that behavioralistic also is saying whatever we learned from childhood, we used to reciprocate in adulthood. It means family environment, it means your child rearing practice and parental environment is very important. So it has been seen if there is ineffective parental monitoring in the child, the problem can be generated, or absent or inappropriate discipline, either of the part. For example, if mother is absent, having discipline is lacking, or inappropriate discipline, that can lead to childhood issues. Then absence of parents, parental criminality or deviance, this can be another aspect which is very important, or minimum parental form. So that is the only reason the family and parental factor are very important in childhood behavior. Then, of course, personal factor. For example, poor peer relationship, limited academic performance, unhealthy family relationship. These are the few factors which is very important for behavioral disorder. Another disorder, if we talk about second category, one is behavioral disorder, we discuss ADHD. Now, very common disorder which you are seeing in your practical clinic, like that is known as developmental disorder. बहुत सारे बच्चे आजकल आपने देखे हैं, मूवीज भी आजकल आपने देखी हैं, जो जो मीडिया भी इसको आजकल बता रहे हैं अपने सिनेमा में. फॉर एग्जांपल, वी आर टॉकिंग अबाउट लर्निंग डिसऑर्डर, तारे जमीन पर, वी आर टॉकिंग अबाउट मोटर स्किल डिसऑर्डर, autistic spectrum disorder, and mental retardation, which is known as intellectual disability nowadays. So these are the known as developmental disorder. तो लर्निंग डिसऑर्डर, अगर मैं बहुत कॉमन लर्निंग डिसऑर्डर की बात करूं, दैट इज रीडिंग डिसऑर्डर, दिस इज नोन एज डिसलेक्सिया, देन मैथमेटिक डिसऑर्डर एंड डिसऑर्डर ऑफ रिटन एक्सप्रेशन. So these are the very important issues which we should consider in child behavior, and how to recognize this childhood disorder. For example, if a person or child having below expected of his age of intelligence level, or his education level is below 2 standard deviation, then we can diagnose, or then we can recognize any issues which is related to learning disorder. And why we want to study learning disorder? There are various issues, like if some child is not good in study, or is not good in a class, there are various associated features can exaggerate the issues. For example, low self-esteem, and these low self-esteem and other associated features can be ADHD, can be dropout of rates of school rates, can be autistic feature. So there are various associated features can come into learning disorder. Then we are talking about autism. You are well versed with this term autism. जैसे मैंने बताया कि मीडिया भी आजकल बहुत ज्यादा चाइल्डहुड डिसऑर्डर के बारे में डिस्कस कर रहा है. देयर आर वेरियस सीरियल हु आर टॉकिंग अबाउट ऑटिस्टिक स्पेक्ट्रम डिसऑर्डर, फॉर एग्जांपल अंतरा, पीहू. देयर आर वेरियस इश्यूज is concentrated with autistic spectrum disorder. And you know what is the feature of autistic spectrum disorder? For example, poor eye contact, right? For example, repetitive behavior, stereotype behaviors. These are the few issues with autistic spectrum disorder. और ये भी जब हम बात करें autism spectrum disorder की, it has various range. For example, we are talking about autism, we are talking about atypical autism, we are talking about Rett's disorder, we are talking about Asperger disorder. So there are huge gamut of autism spectrum disorder. और आजकल जब हम इसके पूरे एक अम्ब्रेला टर्म की बात करते हैं, दिस इज नोन एज पीडीडी, pervasive developmental disorder. Why this called is pervasive means same over the period of time the symptom would be same. This is PDD, and it basically affect all the domain. For example, if we talk about psychological, social and educational. So आप कोई भी डिसऑर्डर को सोच के देखिए, कोई भी डिसऑर्डर को आप दिमाग में डालिए, आपको पता लगेगा कि all disorder are basically hampering all these three domains. Either you are talking about ADHD, either you are talking about autism, or you are talking about specific learning disability. This will affect psychology, social maturation, and educational development. And various psychological problems can be related with these particular issues. For example, identity crisis. आप सबको याद होगा एरिक्सन ने कुछ stages दिए child development की. And the major issue, which major concern is with identity crisis. जब हम mental disorder या psychiatric issues की बात करते हैं, psychiatric problem की बात करते हैं, then this identity crisis is very common in child. Right? Then depressive feature. That is very common. We will discuss emotional disorder in few next slides. Then suicidal behavior, anxiety problem, eating problem and drug abuse. इसीलिए हम बात कर रहे हैं, बार-बार हम बात कर रहे हैं प्रिवेंशन की. हम बात कर रहे हैं इसको कैसे रोका जाए, हम बात कर रहे हैं कैसे रिकॉग्नाइज किया जाए इस इलनेस को. वो कब होगा? जब हमको एक अवेयरनेस है. जब हमको एक बेसिक इश्यूज पता है कि हम कौन कौन से डिसऑर्डर को कैसे आइडेंटिफाई कर सकते हैं, बिकॉज दिस फील्ड इज रिलेटेड टू यू, यू आर एक्सपर्ट इन दिस पर्टिकुलर फील्ड, बट देयर आर फ्यू सिम्टम वी यूज टू मिस दैट सिम्टम। तो जैसे हमने मिस किया, उसका प्रोग्नोसिस पुअर हो जाता है, उसको प्रिवेंशन को हम रोक नहीं सकते, देन प्रॉब्लम विल बी डेटोरेटिंग। दैट इज द मेजर इशू वी आर डिस्कसिंग ऑल दिस इन डिटेल। देन very major issue which we have discussed here, emotional disorder in children. बहुत कॉमन डिसऑर्डर है जो आप इजीली आइडेंटिफाई कर लेते हैं। फॉर एग्जांपल एज आई टॉक्ड अबाउट ADHD इजीली आइडेंटिफाई हो जाएगा आपको क्लासरूम में, स्कूल में, नेबर्स में। जब हम बात करते हैं लर्निंग डिसेबिलिटी, इजीली आप आइडेंटिफाई करेंगे बीइंग ए स्पेशल एजुकेटर। जब हम बात करते हैं अदर इश्यूज, फॉर एग्जांपल कंडक्ट डिसऑर्डर, ODD, यू कैन identify, but if we are talking about emotional disorder in children, that is very important aspect. बहुत सारी ऐसी चीजें जो मिस कर देते हैं इमोशनल डिसऑर्डर। तो इमोशनल डिसऑर्डर होता क्या है बेसिकली? सी, इमोशनल डिसऑर्डर रेफर टू डिस्टरबेंस इन मूड एंड व्हिच बेसिकली इंपेयर योर फंक्शनिंग। बहुत सारे जो जो हम बात करते हैं डिप्रेशन में, कॉमन सिम्टम है फॉर एग्जांपल सैडनेस ऑफ मूड, डिक्रीज इंटरेस्ट, डिक्रीज कंसंट्रेशन, suicidal ideas, bleak future. So all these symptoms can hamper in the same line to the child. उसके एकेडमिक परफॉर्मेंस में दिक्कत आई, उसके आइडेंटिटी प्रॉब्लम में दिक्कत आई। सो दीज आर द फ्यू इश्यूज। देन इमोशनल डिसऑर्डर बेसिकली समटाइम अंडररेटेड इन चाइल्डहुड। आप हमेशा देखिएगा अडल्ट की बात करें उसमें हम इजीली डायग्नोज कर देते हैं, हम इजीली उसको रेट कर देते हैं, बट इफ यू आर टॉकिंग अबाउट चाइल्डहुड इमोशनल इश्यूज, वी यूज्ड टू मिस दैट पर्टिकुलर इश्यू। हम स्कूल में अगर बात करें तो मेजर सिम्टम बात करेंगे कि बच्चे का पढ़ाई में मन नहीं लग रहा। Why he is not concentrating or study? We are not making any effort to make a diagnosis. That's why this is very important. And sometimes the children are confused in their reporting of psychological problem. अगर मैं 4 साल, 5 साल, 6 साल या 7 साल के बच्चे की बात करूं, how he is coming out with that particular emotions or problems, you don't know. एक अडल्ट आके बता सकता है कि डॉक्टर साहब आई एम फीलिंग वेरी सुसाइडल। एक अडल्ट आके आपको बता सकता है सर आई एम फीलिंग वेरी डिप्रेस्ड, प्लीज डू समथिंग फॉर मी। बट इफ वी आर टॉकिंग अबाउट अ चाइल्ड, he will just cry. So these symptoms we used to miss, and that's the only issues. This emotional disorder to identify in children is very important. Once we identify the symptom, I think that can be very useful, right? Then there are few other disorder, emotional disorder, for example separation anxiety, for example phobia, for example social anxiety, sibling rivalry, and other childhood emotional disorder. We are discussing one by one here. Separation anxiety is very common. आपने देखा होगा जब बच्चा फर्स्ट टाइम स्कूल में जाता है, how he used to react. So this separation anxiety is very common and that is very necessary. But किस टाइम तक हम उसको डायग्नोस करेंगे कि ये सेपरेशन एंजाइटी है, किस टाइम हम बोलेंगे कि नॉर्मल एंजाइटी है? मैं आपसे एक सिंपल सा एग्जांपल देके बात करता हूँ। फॉर एग्जांपल इफ somebody has their own family and some loved one has been expired, he must feel depressed, he must feel sad. वो नॉर्मल है ना, वो इमोशन होना भी चाहिए। if कोई बहुत घर में कोई बहुत क्लोज कोई एक्सपायर हुआ है, टाइम कितना होना चाहिए, within how many days we should improve, within how many months we should improve, that is very important. We won't diagnose depression of that particular patient or that individual, we will make diagnosis of grief and bereavement. कुछ टाइम लगता है उस हादसे से बाहर आने में, उस एक्सीडेंट से बाहर आने में। सो दैट इज वेरी कॉमन, वी वोंट डायग्नोस। इन द सेम केस इन चाइल्ड एंजाइटी, सेपरेशन एंजाइटी, वी वोंट डायग्नोस immediately. So it won't some time so that we can make a diagnosis of separation anxiety. When the anxiety level are very high in the children, these are the warning signs we should identify. The child academic and social life is hampered due to that separation of that particular object. Disturbed sleep and appetite, and the family dynamic is basically responsible for the child condition. So this is very important in child particular population. And as I said you, अगर हम इसको टाइम पे टारगेट करेंगे, अगर हम इसको टाइम पे डिस्कस करेंगे, maybe we can use some prevention aspect. Then we are talking about phobia. As you know, that is very common. For example, we are talking about lizard phobia, injection phobia, homophobia, social phobia. This is a very common in adult population. Like कभी-कभी आपने देखा हो किसी को लिफ्ट में जाने से डर लगता है, किसी को फ्लाइट में बैठने से डर लगता है. This is very common. But how it comes in childhood? और उसका symptoms कैसे होंगे? The symptom would be same. For example, intense irrational fear of a particular object or situation. उसके अंदर वो सारे सिम्टम्स होते हैं जो फोबिया में एडल्ट्स में होते हैं. लेकिन बच्चों में एक जो मेजर चीज देखने को मिलेगी आपको, द सोमेटिक कंप्लेंट विल बी मोर। फॉर एग्जांपल नोजिया, मसल पेन, डायरिया, डिस्टर्बेंस इन मोटर कोऑर्डिनेशन, बार बार वोमिटिंग आएगा। जैसे आपने देखा होगा कई सारे बच्चे जब स्कूल जाते हैं फर्स्ट टाइम, दे यूज्ड टू गो फॉर दे फील नोजिया, दे यूज्ड टू गो फॉर वोमिटिंग, स्टमक एक बताते हैं, हेडेक बताते हैं। तो द सोमेटिक कंप्लेंट्स बेसिकली कम इन child population. And the other severe cases in phobia, bedwetting is very common, right? So these are the few symptoms is basically coming phobic child. Then social anxiety. Social anxiety would be a same feature as anxiety disorder or phobia. For example, anxiety to meet new people, न्यू स्ट्रेंजर। आपने देखे होंगे जिन बच्चों को एंजाइटी बहुत ज्यादा होती है, वो नए जब भी कोई गेस्ट आते हैं घर में, उनसे मिलने में हेजिटेट करते हैं, रूम में अपने आप को बंद कर लेते हैं। दे यूज्ड टू अवॉइड द पीपल, सोशल एनकाउंटर नहीं करते वो, दे प्रेफर टू स्टे अलोन, दे प्रेफर टू लीव दैट सोशल गैदरिंग। दीज आर द सिम्पटम ऑफ social, this one. Then we are talking about depression. This is a very interesting phenomenon. Nowadays we are seeing there are so many cases of child depression is coming to us. मैं आपको एक recent study बताता हूँ जो झारखंड में हुई है। They are saying after COVID the cases has been increased till up to 134%. Can you imagine this data? Means after COVID-19 this symptom has been increased, and we are seeing so many childhood patients in this particular. So child populations has depression also. It doesn't mean कि only depression जो होता है वो adult बंदों को होता है। Depression जो होता है सिर्फ males और females को होता है, ऐसा नहीं है। The depression is very common in child population also, and the symptom would be a bit different from adult population. For example, irritability is very common in child population. अगर मैं adult की बात करूँ, उनके अंदर वो आके बताएंगे कि they are feeling sad. सर किसी काम में मन नहीं लग रहा, सर मरने का मन कर रहा है। But in child population the symptom would be indirect. For example, irritability, aggression, continuous feeling of sadness, social withdrawal. They want to stick alone rather than they want to mix up with the people. उनके जो खाने की हैबिट होगी that either increase or decrease, change in sleep and crying spells. So these are the common symptoms in child population. जैसा मैंने बताया कि हम चाइल्ड पॉपुलेशन से हम डील कर रहे हैं, तो बहुत कॉमनली क्या है हमको जो देखना है, मास डिप्रेशन, ऑर्थोपेडिक प्रॉब्लम है, किसी को डायबिटीज है, किसी को हाइपरटेंशन है, they used to share easily, they used to share. But when we are talking about depression, उसके साथ स्टिग्मा अटैच है. This is known as invisible illness, जो दिखती नहीं है. इसी तरह से मास डिप्रेशन होता है, that is very common in adolescent age. अगर मैं चाइल्ड और एडोलसेंट की बात करूं, that is very very common. यहाँ पे आपको देखना पड़ेगा कि जो इलनेस है, जो सोमेटिक कंप्लेंट्स बच्चा बताता है, फॉर एग्जांपल जैसे मैंने बताया सोमेटिक कंप्लेंट्स बताता है, बेड वेटिंग बताता है, बिहेवियरल इश्यूज बताता है, स्कूल में प्रॉब्लम बताता है, दैट यू हैव टू टारगेट ऑन दैट पर्टिकुलर इश्यूज. कुछ वार्निंग सिग्नल जैसे मैंने आपको बताया, इरिटेबिलिटी, टेम्पर टेंट्रम है ना, थोड़ी सी बात पे रोना शुरू कर देना. These are the few warning signs you must observe at school as well as at home, because हमें उसको ध्यान में रखना है. If we miss that particular symptom, the problem will escalate. Then post-traumatic stress disorder. This is known as PTSD. This is another disorder which is very common in child population. अगर PTSD की मैं बात करूँ तो domestic violence is very very common. For example, physical abuse, sexual abuse and emotional abuse. और मैं आपको कुछ ऐसे illnesses के बारे में डिस्कस करूंगा कि अगर मैं बात करूँ physical और sexual abuse की, they are responsible for mental illness. जैसे कि मैं आगे चल के डिस्कस करूंगा आपसे borderline personality disorder, जो बेसिकली एडोलसेंट गर्ल्स में ज्यादा होता है, या आजकल चाइल्ड केसेस भी देखने को मिल रहे हैं. सो डोमेस्टिक वायलेंस इज अ प्रिकर्सर ऑफ मेंटल इलनेस, और उसमें भी दो बेसिकली फिजिकल एंड सेक्सुअल अब्यूज. वेरियस न्यूज यू कैन हर्ड अबाउट दिस डोमेस्टिक वायलेंस इन वेरियस सिटीज ऑफ इंडिया. देन चाइल्ड सुसाइड. पहले हम एक मिसकंसेप्शन हमारे दिमाग में था कि बच्चे सुसाइड नहीं करते, ओनली एडल्ट्स गो फॉर सुसाइड. नो, आजकल का डाटा अगर आप WHO का CRE का देखेंगे तो मैक्सिमम पॉपुलेशन कम्स इनटू दैट पर्टिकुलर कैटेगरी, दैट इज एडोलसेंट एज, 15 to 19 years of age. So child abuse is very common. होता कि में child abuse, that is another aspect. There is so many leading causes for death in adolescent worldwide, and depression is the strongest individual risk factor. So what can be the risk factor which you should basically think about particular that issue? You should not ignore that particular issue. One is suicidality in the family. अगर किसी फैमिली में सुसाइड की हिस्ट्री है, यू मस्ट बी केयरफुल अबाउट दैट पर्टिकुलर चाइल्ड. इसको बोलते हैं साइकोलॉजिकल ऑटोप्सी. देन इफ बच्चे ने पहले कभी सुसाइडल अटेम्प्ट किया, जैसे आपने आजकल एक बड़ा फेमस के गेम था, मे बी यू हर्ड अबाउट PUBG. That was very famous game, and people go for suicide. So these are the few history which is very very important, like comorbid of psychiatric disorder, substance abuse का अगर history है तो excess of lethal means, अगर आपको लगता है कि आसपास बहुत ज्यादा कोई lethal means है population में या उस particular sector में, you should be very careful. Experience negative life event, for example, death of a parents, death of a family member, sudden financial loss in the family. So that will affect child behavior also. It can be sudden loss for the parents, sudden loss of financial issues in the parents, but uska kahin na kahin direct, indirect effect will come to the child population. So these are the risk factors we should be very, very careful when we are talking about suicidality. Then these are the few warning signs we should be careful for a dramatic change in personality. Trouble with the friend circle, difficulty in concentrating, sign of depression, listlessness, change in sleeping habits, doesn't worry about the appearance, talks about suicide, complaints regularly being sick. So these are the few warning signs we should take care in teen population. Now, this is very interesting phenomenon as I discussed how domestic violence can lead to mental illness. This is very common, that is known as borderline personality disorder. BPD बोलते हैं इसको. That is very common in child population. और कॉमन इन एडल्ट्स में कर, अगर अब बात करूं मैं 14 से 18 साल की जो बच्ची हैं, जो गर्ल्स चाइल्ड है, दे कम्स विद दिस पर्टिकुलर सिम्पटम. डिप्रेशन होता है बट दे यूज्ड टू कम विद सेल्फ डेलिब्रेट सेल्फ हार्म. जैसे आप देखेंगे स्लैश होंगे कटिंग की हुई, बहुत ज्यादा स्लैश कटिंग करते हैं, जब भी परेशान होते हैं दे यूज्ड टू कट देयर स्लैश. सो दिस इज नोन एज बॉर्डरलाइन पर्सनालिटी डिसऑर्डर. So ये सारे डिसऑर्डर के हमने बात की वन बाय वन. फॉर एग्जांपल बिहेवियरल डिसऑर्डर, वी टॉक अबाउट ऑटिज्म, वी टॉक अबाउट डेवलपमेंटल इश्यूज, लर्निंग डिसेबिलिटी और इमोशनल डिसऑर्डर जो बहुत कॉमन है आजकल बच्चों में. सिर्फ हम पहले की अगर मैं बात करूं सिनेरियो, वी वर थिंकिंग अबाउट इंटेलेक्चुअल डिसेबिलिटी वाज द प्रॉब्लम इन चाइल्ड. नो, not only intellectual disability was the prominent in child population, but the emotional disorder is very common in child population, and we should target that emotional disorder. अगर हम इंटेलेक्चुअल डिसेबिलिटी का प्रिवलेंस देखेंगे, दैट इज नॉट टू गुड, बट इफ यू डिस्कस अबाउट द प्रिवलेंस ऑफ डिप्रेशन, more than 5 to 7% in child population, that is a warning sign. That's why we are discussing all this issue. Now the question arises, how to assess it. And you should follow these special educators who are working with this particular age group. So like for example, intelligence test, projective techniques, assessment for ADHD, autism, SLD, and disability assessment. These are the very common this one, and we should discuss one by one. I won't go in detail. Like for example, intelligence test, all aware about William Social Maturity Scale, all is aware about DST, Binet Kamath test, MISIC. So I will not go in detail, but these are the tests to assess intellectual disability. The another test which is very important in child population per se is projective test. Very common test which is known as draw a person test. You must have heard about this particular test. So these tests are very very common for child population, and these tests give the complete personality assessment of the child, right? Then we are talking about disability. For example, we assess intellectual issues, we discussed about depression, we discussed about social or emotional issues in children. There are few issues in this particular age group we can give the disability. आज मैं इंडिया की बात करूं, there are no any disability scale is there for child population, but there is one test for assessing for mental retardation, that is known as assessment of disability in person with mental retardation. So same जैसे हम बात करते हैं adult population की, schizophrenia, bipolar affective disorder, depression, जैसे हम उसमें disability देते हैं, the same way we are giving disability to the child population, like perceptual motor, self-care, communication, academic, and occupation. So all these domains basically give the disability to the child. Now the major questions comes into mind. We have discussed about psychological issues, we have discussed about assessment, how to manage this child. आपको क्या लगता है, same management will apply as we are discussing about adult population, or the management will be changed? So here we should be very concentrated on that particular issue. The management would be changed. उसका management जैसे हम adult population के साथ psychotherapy कर रहे हैं, adult population के साथ pharmacological management कर रहे हैं, वैसा नहीं होगा. मैनेजमेंट वुड बी चेंज. थेरेपी के जो सेशन है वो आपके चेंज होंगे, जो आपका इंटरवेंशन प्लान है दैट विल बी चेंज. सो कुछ जनरल प्रिंसिपल है साइकोथेरेपी के जो बेसिकली चाइल्ड एंड एडोलसेंट पॉपुलेशन पे फिट बैठते हैं. मैं इसलिए आपसे बार बार इस पे एम्फेसिस कर रहा हूँ बिकॉज एटलीस्ट आपको ही पेशेंट को देखना है, आपको ही बच्चों को देखना है। द मैक्सिमम टाइम यू आर स्पेंडिंग विद द चाइल्ड, and I told you, if you can rectify, if you can manage one child in your life, you will feel very great to yourself. So मैनेजमेंट कैसे कैसे कहाँ पे डिफर करता है चाइल्ड पॉपुलेशन का, एज वी नो कि जो थेरेपी की बात करते हैं, जो बड़ी फेमस है थेरेपी की एक डेफिनेशन बाय वुलबर्ग इज ट्रीटमेंट ऑफ ए प्रॉब्लम ऑफ एन इमोशनल नेचर, जहाँ पे प्रोफेशनल रिलेशनशिप मेंटेन करते हैं पेशेंट के साथ टू रिमूव, मॉडिफाई और रिटार्डिंग एग्जिस्टिंग सिम्टम एंड मीडिएटिंग डिस्टर्ब पैटर्न ऑफ बिहेवियर, और हम उसको पॉजिटिव ग्रोथ के लिए आगे बढ़ाते हैं। ये दिस इज अ वेरी मेजर डेफिनेशन ऑफ साइकोथेरेपी। लेकिन अगर हम चाइल्ड साइकोथेरेपी की बात करें, उसमें ये थोड़ा सा चेंज होगा। यहाँ पे साइकोथेरेपी का जो प्लान है, जो इंटरवेंशन, दैट वुड बी चेंज बिकॉज द मैक्सिमम प्रॉब्लम इज विद चाइल्ड इज इमोशनल। इमोशनल चाइल्ड की जब हम बात करते हैं, द मैक्सिमम ट्रीटमेंट वुड बी कम्युनिकेशन। और जब कम्युनिकेशन की बात करते हैं, बच्चे ओपन नहीं होते, they try to open with that particular issue, but they don't know how to choose the words, how to discuss the problem with the therapist. So on that time there are few technique, for example playing, drawing, building, and pretending as well as talking is a very good methods to treat the child. Therapeutic alliance यहाँ पे the basically we maintain through these basic issues, जिसको हम play therapy बोलते हैं, play observation बोलते हैं, drawing therapy बोलते हैं। This is more useful। और इंटरेस्टिंग बात क्या है जो मैं आप लोगों से डिस्कस करना चाहूंगा, क्यों चाइल्ड साइकोथेरेपी इज डिफरेंट फ्रॉम एडल्ट साइकोथेरेपी, दैट इज अनदर इंपॉर्टेंट एस्पेक्ट। लाइक फॉर एग्जांपल behavior can be a part of normal development। बच्चों की population में we basically see like if somebody is hyperactive, if somebody is having some problem in learning disability, so we think this is a normal part of development. If we think normal part of development, we try not to intervene that particular part. This is a basic issue. Then children don't refer themselves for treatment. As I told, adult can go, but children, they used to avoid, they don't know how to approach. And the third, children are dependent on the family and child alone not to the client। So यहाँ पे बेसिक इंपॉर्टेंट चीज क्या है, यहाँ पे सिर्फ आप चाइल्ड को टेक नहीं कर रहे, यहाँ पे आपका कंसंट्रेशन सिर्फ चिल्ड्रन पॉपुलेशन नहीं है। द कंसंट्रेटेड वुड बी फैमिली, the concentration would be on society, the concentration would be on teacher, so all the aspect we have to deal। So these are the four major issues which differentiate from child psychotherapy to adult psychotherapy, because they are not aware about the illness, right? And they can't go to the treating doctor, right? The other issues which basically differentiate from child to adult psychotherapy, the therapist and patient relationship। Like if it talks about adult psychotherapy, अगर child psychotherapy की बात करते हैं तो यहाँ पे थोड़ा सा relationship differ करता है। यहाँ पे therapist की personality कैसा होना चाहिए, he must be extroverted। उसको टीचर या थेरेपिस्ट कोई भी बात करें, he should be assertive, he should be open। जब हम ये सारी चीजें साथ लेके चलेंगे, then only we can make an interpersonal relationship or psychotherapeutic alliance with the child। That is very important aspect। Then कुछ फंडामेंटल्स हैं जो थेरेपी के, जो चिल्ड्रन में हम यूज करते हैं, जो हम बात करते हैं। द वेरी इंपॉर्टेंट रिलेशनशिप पार्ट इज थेरेपेटिक ओरिएंटेशन टुवर्ड चिल्ड्रन, देन थेरेपिस्ट इंटरपर्सनल स्टाइल, देन थेरेपी लैंग्वेज। ऑल थ्रीज आर वेरी इंपॉर्टेंट व्हेन वी आर डिस्कसिंग दिस पर्टिकुलर डोमेन। थेरेपी फंडामेंटल में हम क्या क्या डिस्कस करते हैं, फॉर एग्जांपल वी आर टॉकिंग अबाउट असेसमेंट, सेशन स्ट्रक्चर, मेंटेनिंग डिसिप्लिन, एम्पैथेटिक रिफ्लेक्शन एंड गोल सेटिंग। दीस आर द वेरी इंपॉर्टेंट फंडामेंटल ऑफ चाइल्ड साइकोथेरेपी। Therapeutic collaboration is very important। As I told you, child population में जो जितने भी psychotherapies होती है, that is based on both the parties, therapist as well as child। So therapeutic collaboration is very important। Then different domain, whatever we are using in adult psychotherapy, for example psychoanalysis, behaviorism, cognitive psychotherapy, all we can use in child psychotherapy, but the form will be a bit different। For example, in psychoanalysis or psychodynamic psychotherapy, here in child population, we basically increase self-understanding of the child. Then we try to increase acceptance of feeling and wishes. Then replacement of unconscious mind into conscious mind, or to increase coping strategy and to develop the realistic behavior। So these are the few domains। IIRD is known as psychodynamic element। सेम हम बात करते हैं साइकोलॉजिकल पोजीशन की, अनकॉन्शियस माइंड की, कॉन्फ्लिक्ट की, डिफेंसेस की, मल्टीपल मीनिंग्स की, बट नॉट लाइक एडल्ट साइकोथेरेपी, not as free association, not as psychoanalysis, not as hypnotism। Here our basic concentration on play therapy plays important mean of self expression of its young child। इसलिए बोलते हैं ना कि बच्चों को मैक्सिमम टाइम खेलने के लिए दीजिए। We have to play with the child. और अगर हम बच्चे को समझना चाहते हैं, become a child. That is important aspect. आप बच्चे को adult बन के नहीं समझ सकते, आप बच्चे को बच्चा बन के समझ सकते हैं. So if you will play with the child like a child, you can understand much realistically. So play therapy can have meaningful issues which can give the unconscious mind of a child. Thoughts ko, feeling ko, how to express, he can learn from the play. And play is a self-healing process. So play therapy is a dynamic process between child and play therapist. And child explore his own pace, explore his own past and present issues, explore his own conscious and conscious life. So this is very important aspect of child psychotherapy. As I told you, it is a medium of exchange, it is a medium of defense, and it basically reveals so many issues. Very famous play therapy is given by Exeline, Virginia Exeline, who is talking about non-directive play therapy. जैसे बच्चा आता है आपके पास, आप उसको free छोड़ के just see his activity, his involvement with the toy. That will give indication of his personality, which type of personality the child is having. The basic aim to encourage communication, to understand his conflict, to facilitate normal psychological development, to give the emotional expression of catharsis, facilitate imaginative play. क्योंकि बच्चे में आप देखेंगे imaginative play बहुत ज्यादा होता है rather than adult. अगर आप उसको बोलो क्लाउड दिख रहा है आपको and you just make imagination, he will make imagination of a cloud. It means his imagination is very good in this particular population. So it basically develop or express cognitive, affective, interpersonal and conflict resolution process. That is very important in child population. Right? Then we are talking about behavior therapy. I won't go in detail. Everybody knows behavior therapy is very important in psychology. For example, we are talking about conditioning, we are talking about reinforcement and various methods we basically use. And major assumption, जो भी आज हम है, that is based on learning. If you want to change our personality, we have to learn. We have to retract our learning. So everything is based on learning. For example, in psychoanalysis, they are saying everything is based on psychological development. Everything is based on sexual development. But behavior therapy is saying everything is based on action orientation or directive behavior. So everything we use to learn. For example, they are talking about classical conditioning, operant conditioning, observational learning. So these are the few techniques which we can treat the child. The another aspect which is very important, that is known as CBT. Like we're talking about cognitive behavior therapy. Basically, cognitive behavior therapy is very suitable for adult population because their mind has been fully developed. Their logical mind has been developed. But in normal population, in child population, it basically gives more chances to behavior therapy rather than CBT. Then we talks about thought, feeling, and behavior of the child, which affect childhood behavior, and we have to retract that particular negative thought, schema, and belief of the child to come out from that particular depression. Then another very important aspect is parent training. As I told you, child is not only patient. Child is not only client. There are various issues involved, like for example, family, society. So here we have to be the parent training. And over there, the component would be assessment, psychoeducation, prevention strategy, consequences, generalization, maintenance. Without assessment of parents, you can't do anything. Then you have to psychoeducate about the illness. Then we have to use some prevention strategy, its consequences, and then we can generalize particular issues. So parent training is very important. Various training module has been available. For example, child parent interaction therapy, PMT, community parent education program, positive parenting program, which is very important in child population. Though this is not very much well versed in India, but if you will go in abroad, various program is running for that particular population. Then yes, group therapy is very important for child population. So they used to participate in a group life. They used to share their behavior, interpretation of their thoughts. They used to learn from that particular group. So behavioral therapy is another aspect. For example, psychotherapeutic group we can maintain. For example, in depression, OCD, social anxiety. That social skill group in autism is very important. Sport group is very important. For example, we are talking about HIV or AIDS, and goal focus group is very important. As I said, family therapy is important because we have to target family also, so that this can work as a maintenance factor. There are few techniques which is very pertinent to the disorder. For example, we are talking about autism. So there is a few program which is going to be, working on that particular population. For example, ABA. Then we are talking about PECT. Then we are talking about TEACH, LEAP. These are the few programs which basically working on early intervention, behavioral intervention. And it is an intensive program for autism. Then evidence-based therapy. We are not saying we are just talking about BT, CBT in Hawaii. There are various evidence-based program is there, which basically works in particular population. And you can see CBT is working in depression, parent management training can be useful in disruptive behavior, functional family therapy can be useful in adolescent substance abuse, and various technique and various issues are involved in particular population. So here we summarize that psychotherapy in children has special feature to consider, such as behavior from normal development, lack of autonomy of the child, involvement of family in therapeutic process are very, very important. Once you won't target that particular domain, the child will be drop out. The inherent challenges in dealing with children comes from their lack of cognitive capacity because of expressive issues, thought issues, show resistance to the suggestibility, and there are major domains of problem. For example, we talk about externalizing behavior, internalizing behavior, substance abuse issues, which is very common in child population. So as a whole, we have to see the whole gamut of the psychiatric issues, which basically important child population. कोई भी प्रॉब्लम का आप नाम दीजिए, कोई भी प्रॉब्लम आप बताइए, we have to see the solution of that particular problem. As I told you, we are dealing the whole family, we are dealing whole society for that particular issue. So here prevention part is very important when we want to target that particular problem. So with this particular session, I want to close my session. I must be thankful to Patience Learning. Thank you very much.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you very much, sir. Anybody want to ask any query, any comment, questions, they can be discussed with on that platform.
थैंक यू। आप लोग किसी को सर को कुछ पूछना है तो आप लोग को सर का टॉपिक के बारे में आप लोग पूछ सकता है। अनम्यूट हो जाइए, आप लोग स्पीकर को अनम्यूट करके सर लोग को पूछ सकता है। सर को आज हम लोग को जो सेकेंड रिसोर्स पर्सन था डॉक्टर किशन कुमार सोनी सर, इनका जो टॉपिक का बारे में आप लोग कुछ पूछना चाहिए तो पूछ सकता है। सर आपका स्पीकर को ऑन कर दीजिए सर।
सॉरी, या
हेलो सर
जी।
सर आपका ये जो पीपीटी आप बनाया वो कैसे पाओगे?
वो मिल जाएगा, आप लोग को हम ग्रुप में दे देंगे।
ओके,
व्हाट्सएप जो ग्रुप है, ग्रुप में मिल जाएगा आप लोग को।
ओके।
हेलो सर
जी,
हाँ बोल रहे सर, मास डिप्रेशन ठीक से बताइए ना सर एक बार।
ओके देखिए, मास डिप्रेशन का मतलब क्या है? मास का मतलब मुखौटा, जिसको हिंदी में बोलते हैं ना, मुखौटा। मतलब आपको देखने से पता ही लगेगा कि किसी बच्चे को डिप्रेशन है। अपने आसपास देखिए, दो आप थोड़ा सा एक्सपीरियंस मैं आपको देता हूँ। एक तो इंसिडेंट बताता हूँ। कोई आसपास आपके होता है, आपको पता ही लगता है ही परेशान है ना, ही इज अपसेट, लेकिन सडनली पता लगता है ही मेड अ सुसाइड। फॉर एग्जांपल दैट फेमस केस ऑफ दैट सुशांत राजपूत, everybody was saying he was very happy, he was very jolly, suddenly he made a suicide. That is known as mass depression. आपको डे टू डे लाइफ में पता ही नहीं लगेगा। और ये जो मास डिप्रेशन है, दैट इज वेरी कॉमन इन चाइल्ड पॉपुलेशन।
ये आप लोग स्पीकर को ऑफ करिए।
या सो बेसिकली वो मास डिप्रेशन दैट इज वेरी कॉमन इन चाइल्ड पॉपुलेशन। वो आपको शेयर नहीं करेंगे, आपको पता भी नहीं लगेगा कि बच्चा कैसे आ रहा है, बट उसके सोमैटिक कंप्लेंट्स, टेम्परल टेंट्रम, एग्रेशन और इरिटेबिलिटी समटाइम कैन लीड टू दैट पर्टिकुलर इशू। सो मास डिप्रेशन में आपको सारी चीजों का आइडिया होना चाहिए, आपको पता होना चाहिए कि कौन सी चीजें प्रॉब्लम कर रही है, देन ओनली यू कैन आइडेंटिफाई द प्रॉब्लम। इसलिए चाइल्ड पॉपुलेशन यू मस्ट बी वेरी मच अवेयर। जैसे फॉर एग्जांपल कोई बच्चा स्कूल में लेट जा रहा है डेली, but he is not interacting with the people, he is showing his withdrawn behavior, so we should not ignore that particular behavior. Maybe this is a mass depression. सो इन चीजों को आपको बहुत अच्छे से जब आप इस पे ध्यान देंगे, जब आप इसको ध्यान से देखेंगे, मे बी यू कैन रेक्टिफाई एंड यू कैन आइडेंटिफाई दैट पर्टिकुलर इश्यूज। ठीक है बाबूराम जी? ओके, should I read
और
this
किसी
chat
को कुछ
box?
पूछना है तो आप लोग
There is one
पूछ
question from
सकता है।
chat box. In your area, explain which therapeutic orientation work the most. See, that's depend on this is Anita. Hello. Hello. Anita Shiva, this is your question. Are you here? Hello. Anything else?
किसी को कुछ पूछना है तो
हेलो हेलो
जी
हेलो सर
जी
how to improve ADHD speech development age above 7 years old.
Basically, ma'am, like you can unmute yourself, then I'll respond, ma'am. Hello.
Hello.
हाँ जी, you can unmute.
Sir,
Then you mute yourself, then I can respond because there is. Yes. See, basically that's depend. You are talking about speech issues in ADHD. See, we are working in a multidisciplinary approach. Being a mental health professional, being a special educator, being a speech therapist. So that's depend like in which area there is a lagging. For example, in problem is speech area, then we can go for speech therapy. Or that's depend in ADHD which domain we are talking about, attention deficit or hyperactivity. If this is attention deficit, first we can improve his attention through various tasks. For example, we are talking about brain sorting tasks. For example, how to enhance attention span. So if once we will increase or improve his attention span, then only we can include or we can involve in speech therapy. So आपका काम होगा enhancement करना उसके attention को, speech therapist का काम होगा speech therapist का. So this is a multi-disciplined approach. In both the approach we can target.
Sir.
Hello, sir. Namaskar.
Sir, I see after 7 years, child cannot improve speech and language development, ADHD and ASD.
नहीं, ऐसा कोई लिटरेचर नहीं है मैडम जो ये बोले कि किसी एक पर्टिकुलर एज के बाद कोई प्रॉब्लम ज्यादा शुरू होता है, ऐसा नहीं है. हाँ, ASD में there are few another issues. For example, if you are talking about autism, because of his mind theory, है ना, he is not giving any attention to that particular stimulus. वहां पे हम बात कर सकते हैं, बट ADHD मुझे लगता है उसका प्रोग्नोसिस थोड़ा सा ऑटिज्म से ठीक होता है. ऑटिज्म का थोड़ा प्रोग्नोसिस ज्यादा खराब होता है.
हेलो सर, नमस्कार
जी
सर, मालदा से बोल रहा हूँ सर.
जी
हम बोल रहे हैं सर, कोई अगर मेंटल. हेलो सर.
जी जी मैं सुन रहा हूँ सर.
हम बोल रहे हैं सर, कोई मेंटल रिटार्डेशन बच्चा अगर 17 साल के अधिक से छुप के कोई नशा कर रहा है तो उसका क्या समस्या समाधान करना है सर?
नहीं, उसको ना सबसे पहले देखो दो चीजें इसमें, एक तो इंटेलेक्चुअल डिसेबिलिटी है और उसके कोमोर्बिड सब्सटेंस अब्यूज की भी है. ये बहुत ज्यादा पॉइजनस कॉम्बिनेशन है क्योंकि बहुत सारी फिजिकल इलनेस भी हो सकती है. फॉर एग्जांपल वी आर टॉकिंग इंजेक्शन से या सब्सटेंस अब्यूज से कई बार सेक्सुअल ट्रांसमिटेड डिजीज भी हो जाती है. HIV अगर हम बात करें तो इस पॉपुलेशन में ज्यादा होती है. तो यहाँ पे कोशिश करें कोई ड्रग डी एडिक्शन सेंटर में इसको रखें, उसको टाइम टू टाइम मैनेजमेंट करें, इंटेलेक्चुअल डिसेबिलिटी कितनी है उसको असेस करें, है ना. लेकिन सबसे मेजर एस्पेक्ट है उसके सब्सटेंस अब्यूज को टारगेट करें आप. इंटेलेक्चुअल डिसेबिलिटी जो है वो है, यू कांट डू मच अबाउट दैट पर्टिकुलर इशू, बट यस फॉर सब्सटेंस अब्यूज यू कैन डू. सो वहां पे आपको कंसंट्रेट करना है. जी
ओके सर, थैंक यू सर.
this is Rajeshi Das. I'm a clinical psychologist, and I have actually written my question in the chat box. If you can please enlighten if you have any information on that.
Can you speak your question if you don't mind?
Yeah, so my question is, sir, can you suggest any social support scheme by the government or any private scheme by some company or some NGOs who has a all India based network for tele consultation as well as offline counseling services for the children with behavioral issues of single parents, those who are already subject of judgments, deprivation of social support, and resource and time constraint. So for this particular group, what happens, we try to execute any kind of support for the child, or if we are trying to implement any program for the behavioral modification for the child, that kind of becomes a headache for the single parent who is already stressed and overstressed by so many multidimensional factors. So when, as a psychologist or sociologist or social worker, any kind of advice or any kind of program becomes a burden and also feels like often taken by the parent as an advice which is coming from a place of not knowing the real situation. So this group, I think, is a group where we need to think a little bit more, and there must be, just like UK or England, maybe the government or some private organization can come up with some kind of scheme where to seek the service, the single parent does not have to take any initiative or any extra burden from their side, but the service comes to the home or to the child. So if you have any kind of information regarding that, then it will be really helpful for me.
Yeah, very pertinent and practical question, ma'am. There are few things which is very important which we can discuss here. Like if we talk about CRC, like Composite Regional Center, they are working on that particular direction. For example, if we talk about Chennai CRC, if we are talking about Guwahati CRC, if we are talking about this Northeast CRC, they are basically trying to make some module. And this is online module rather than offline module, and that is basically to work out in this particular population. Like COVID-19 has changed the life of these children. For example, if we are not talking about normal children, disabled children, this problem has exaggerated their issue. On that time, they have started few scheme and policies. If you will go on that particular website, NIPSID or NIPED, this is a very good website, and you can see so many policies which is very useful for the child. And even I'm telling you, government is giving so many policies and benefits to the child, and we are not aware about this particular policies because parents are illiterate. They don't know where to go, how to go. Can you imagine, ma'am, if we are talking about speech problem in our PJMER Chandigarh, we are doing free cochlear implant. The cost is around 4 lakh rupees. Nobody knows about this one. Like 4 lakh rupees, government is giving to the child who is having speech problem. So these are the policies which somebody is or ignorant people, they don't know where to go, how to go. So there are government policies available on the website. Just kindly go through that NIPSID and NIPSID site. There are so many information you can get it, and you will be benefit from that particular site. They have given some module also, online module they have mentioned on that website, and that will be very helpful for the parents. Forget about single parent or double parent, that is a different aspect, but all the population can be benefited that particular program. And I'm telling you, as I told you, just given an example of this cochlear plant, we are doing for free for all the population, irrespective of socio-economic status. Same policies our social welfare department has generated, and time to time they are updating that particular policies. So you can see that social welfare side also, NIPSID particularly side, and if possible NIMH side. They are giving useful information for rehabilitation in this particular child population. That can be useful really.
Thank you so much, sir. Thank you.
Thank you, ma'am.
Okay, thank you, sir.
Thank you, sir.
No.
Thank you, Krishnan, Professor Krishnan.
Thank you, sir.
Thank you. Thank you.
Thank you, sir.
Thank you, Krishnan.
Thank you, sir.
अभी हम लोग का ब्रेक टाइम है सर।
कितना तक? हाँ, कितना तक होगा? 2 बजे?
2 बजे तक है सर।
अभी 1:30, so half an hour break, right?
हाँ, राइट सर।
So ऑनलाइन में क्या खाना पीना मिलेगा हमको?
मिल जाएगा सर, मिल जाएगा।
Okay, thank you, thank you.
Thank you, sir.
Hello, Burman sir.
What I will say because of this. Okay, thank you. We'll be coming again around 2 o'clock IST, right? Thank you, everybody. Thanks. Thanks, Krishnan.
Thank you, Krishnan sir.
थैंक यू सर।
ऑल पार्टिसिपेंट, आप लोग का ब्रेक, आप लोग अभी थोड़ा हम लोग बंद कर देंगे।
हेलो
सर, एक क्वेश्चन था सर।
हेलो बर्मन सर।
बोलून
बर्मन सर,
देखा जाए मेरे को एब्सेंट दिखा रहा
सर,
है, लेकिन मैं तो युक्त था
सर।
बोलून।
हेलो सर।
बोलून।
বলছি আমি মালদা থেকে বলছি স্যার। বলছি স্যার অ্যাটেন্ডেন্স লিংকটা কিভাবে ওটা অ্যাটেন্ডেন্সটা হবে?
অ্যাটেন্ডেন্স আমরা লিংকের মাধ্যমে আমরা নেই না। দেখুন আপনাদের মোবাইলে বা কম্পিউটারে যদি যান, আপনার পার্টিসিপেন্ট নিচে একটা অপশন আছে, হ্যাঁ
স্যার।
সেখানে আপনাদের নামগুলোকে আমাদের যা লিস্টে আছে সেটাতে আমরা সার্চ অপশনে আমরা গিয়ে সার্চ করে আপনাদের নামগুলোকে আমরা চেক করে নেই। যখন যার নামটা আমরা খুঁজে পাই না তখন তারটা আমরা অ্যাবসেন্ট লাগিয়ে আমরা আপনাদেরকে টাইম দিয়ে আপনাকে হোয়াটসঅ্যাপ গ্রুপে আমরা দিয়ে দিচ্ছি। একটু পরেই আপনারা পুরো যে আপনারা অ্যাবসেন্ট যারা ছিলেন আর কি তাদের আমরা পুরো লিস্ট আমরা দিয়ে দিচ্ছি। একটু পরে আপনারা পিডিএফ লিস্ট আপনারা পেয়ে যাবেন হোয়াটসঅ্যাপ গ্রুপে।
ওকে স্যার, অ্যাকচুয়ালি আমাকেও দেখাচ্ছে অ্যাবসেন্ট।
ওকে স্যার,
এই সময়টা আপনাকে পাওয়া যায়নি। আপনাদের একদম আপনার টাইমটা দেখুন, টাইমের সাথে মিলিয়ে নিন। আপনাকে সেই সময় পাওয়া जाएगी। और অনেকের बार-बार বলছি আপনাদের आप लोग का जो नाम है वो नाम आप लोग सिलेक्ट करने नहीं, मतलब मुश्किल हो रहा है, तो इनके लिए बहुत प्रॉब्लम हो रहा है। हम लोग इधर जो सर्च कर रहे हैं आप लोग का नाम का लिस्ट का हिसाब से उनको नहीं मिल रहा है, तो इसलिए हम लोग एब्सेंट दे रहा है। प्लीज हम लोग का मैडम एक वीडियो बना रहे हैं, वीडियो बना के आप लोग को मतलब ग्रुप में हम लोग शेयर करेंगे कैसे आप लोग को नाम को खुद का नाम को आप लोग डालेगा। तो हम लोग पूरी बाद में एक वीडियो आप लोग के लिए शेयर कर रहे हैं, ठीक है? वो वीडियो को देख के आप लोग नाम को खुद का नाम को डाल दीजिए।
सर हेलो सर।
सर
স্যার নামটা চেঞ্জ করা যাচ্ছে না।
নামটা আপনার সৌরভ গড়াই তো ঠিক আছে, বলুন।
আমারটা নয় স্যার, আমার একটা বন্ধু আছে ওই ফকির চন্দ্র পাল, ও বলছে আমি চেঞ্জ করতে পারছি না।
অবশ্যই যাবে। আপনারা আমাদের একটা ভিডিও আমাদের ম্যাডাম তৈরি করছে, ভিডিওটা যখন আপনাকে দিবে তখন আপনারা অবশ্যই পাবেন। ওকে, ঠিক আছে
স্যার প্রোগ্রাম শিডিউলটা একটু দিন না।
আমরা অলরেডি আপনাদের হোয়াটসঅ্যাপ গ্রুপে আপনাদের দেওয়া আছে, আর একবার আমরা সেন্ড করে দিচ্ছি।
হ্যাঁ, লিংকটা একটু দিন না স্যার।
हेलो तोपन दा।
हाँ बोलून विशाल बाबू बोलून।
अभी वो हम लोग ऑनलाइन ही रहना पड़ेगा या अभी 2 बजे तक ऑनलाइन नहीं होने से भी कोई दिक्कत नहीं है? अभी आप लोग ने बोला है ना लंच टाइम है, इसलिए पूछा।
लंच टाइम है, आप लोग बंद कर दीजिए।
अभी हम लीव होने से कोई दिक्कत नहीं है ना?
হ্যালো স্যার, এখন কি আমরা লিভ করতে পারি আবার 2টোর সময় যদি জয়েন করি?
হ্যালো স্যার, বোধহয় লিভ।
আপনারা লিভ হয়ে যান এখন।
আচ্ছা স্যার, থ্যাংক ইউ।
আলি স্যার।
হ্যালো স্যার।
হ্যালো স্যার, আপনাকে আমরা লাঞ্চ পাঠাচ্ছি ইন্ডিয়া থেকে।
হ্যালো স্যার।
হ্যালো।
হ্যাঁ, আমি কি লিভ করতে পারবো? আবার 2টোর সময় জয়েন করা যাবে?
Sure. You can leave. Come just at 2 o'clock IST.
हेलो सर, इसके बाद और क्लास होगा क्या?
हाँ 2 बजे।
I can't understand.
সবাই লিভ করতে পারবেন, সব লিভ।
May I leave it now?
Yeah, no problem. You will just
Okay. Then I will again join at 2 p.m. Okay.
2 p.m. Just have your
Okay, sir.
lunch. Meanwhile, you complete your lunch. You finish your lunch.
Okay, sir.
Okay. Bye.